Hello there, I'm a general surgeon with a passion for the smart use of technology applied to healthcare and medical education. Exponential technologies like Google Glass really paved the way for using XR in the operating room as a teaching tool. I used it for the first time ever years ago, and it really changed the experience of how these tools could be applied to education. The operating room is a theater, is really a show that we put up in a way for those who are learning. It hasn't changed that much over the last several years, from the ORs that you saw there to the ORs that commonly today are crowded with people trying to learn how to operate, to the modern ORs today that have all sorts of equipment and technologies that are vital in order to improve the outcomes in healthcare and in surgical care. Students see what we do, and this is how they learn. Google Glass showed me that I could live stream my perspective, my view of what I was doing to a group of students. And that really changed the discourse a bit on how learning could happen. Rather than them being behind us trying to see what we do, they actually were involved in real time. And we could have this type of tool, Google Glass back then, and now many others, to provide a digital assistant to keep us out of trouble, giving us augmented reality information. Really, it's the natural evolution of the computing platform, from big computers to laptops to iPads to then phones to touch to glass. It is really a pretty intuitive evolution. Same thing happened with telemedicine, where we had the big standing computers to mobile computers then that we could connect to anywhere in the hospital using Wi-Fi technology, and we could have a doctor anytime, anywhere, without the geographic barriers and hurdles that we usually have. And we can go even beyond. The satellite connectivity shows that, like in this case, a video from NASA, where a group of students from a military medical school in the US were able to connect live with the International Space Station. So imagine the power of communication and connectivity using these tools in order to enhance their exposure. This could be a consultation. This could be a learning experience. In the year 2011, when the iPhone 4 came out with FaceTime, Steve Jobs and his group demonstrated that we could do live video connectivity anywhere, anytime. We had a pilot project that used iPod Touch devices using the FaceTime technology in order to let us expand our expertise, export our expertise anywhere in the rural area of the state of Maine in the US. So basically, using a simple tool connected to Wi-Fi, we could really export our expertise and our need for expertise to anywhere in the state for acute trauma patients. And this was just a proof of concept that we did. So it is really exciting to bring this into the operating room. The traditional operating room has been transformed into something that now has tools like the virtual reality controllers, for example, controllers that allow us to add another layer of reality, of external reality, extended reality to what we do. VR, AR, or MR are technologies that have a lot of hype, and like the Amara's law shows you in here, initially we tend to overemphasize, overestimate technologies that are fantastic, almost magical, and in the long run, we tend to really underestimate them. And for example, GPS technology is one of those technologies. So VR, XR, AR have been in a way overestimated today, but in the future it'll be a thing of a daily life. Like it was with the Google Cardboard, now with virtual reality headsets, we can really transform the experience. We can, in a way, transform the perceived experience that the human brain is getting, and in a way use the plasticity of the brain to not just train and educate, but even to heal. We have VR for healing, VR for pain control, for perioperative pain control, for PTSD, for anxiety disorders. VR has been validated to be effective for this type of situations. So Dr. Shafi Ahmed, my good friend, proved this in 2016 when he connected a operating room in the UK in a live fashion with minimal delay for safety reasons to anywhere in the world in virtual reality, 360 connectivity in real time. So number of people could be in the operating room with him operating and learning the proper way to do, in this particular case, a colectomy, for example. We have to go beyond. We have to use imagination and the technology that we have today that comes, most of it, from science fiction to really transform how we deliver healthcare, how we teach, how we learn. You have Tony Stark playing with extended reality here that is not anymore science fiction. This is becoming science. This is becoming reality. We can now today play with this type of situations. You have this rendering I did in the operating room using Animaris, Insight Heart, and using the smartphone with the iCore or the AR Core or AR Kit technology to really teach a group of students the basic anatomy of physiology of a heart condition, of different conditions in augmented reality, in real time. So it is fantastic, the possibilities that we have in order to enhance that communication, that connectivity, and that teaching and learning experience. So I think that the sky is the limit. We're only limited by our creativity. This is an old video from the HoloLens 1, not even the HoloLens 2. And the HoloLens 1 allowed us to represent reality in a different manner. You could have a number of students looking at a realistic anatomic and physiologic model of, in this case, the osseous system, the bones. And imagine how much better you learn, how much better you teach. This is an old cadaveric lab, right? Mortus vivus docent, okay? The death teaching the living. It should be technology teaching the living. We have the tools. This is medical holodeck, transforming how we learn. Basically a real cadaveric specimen in augmented reality with no geographic barriers, with a headset like the HoloLens, for example, or any other iPad, tablet, or computer or mobile device. You can really have the cadaveric lab at home with minimal restrictions. Imagine the potential for planning surgical operations using this type of technology. The old adage of see one, do one, and teach one has been transformed in a way by the use of technology in a smart fashion. Like many things in healthcare, from the aviation industry, we have taken a lot of perks and benefits. Simulation is one of them. We know that it's better to train, to do simulation in ex vivo or without patients in order to do no harm, in order to perfect what we do and how we do things, in order to increase our performance to the top level before we ever get to fly that plane, to operate on that patient, on the living patient, minimizing the risk and maximizing the outcomes. It is the way to go. Simulation has taken a completely 180 almost a degree. We are saving lives with simulation. Companies like Osso VR or Fundamental VR has transformed how we learn, how we teach procedural skills. This is a rendering in virtual reality of a orthopedic procedure. Look at the realism of this visualization. You could do this at home. You could do this at home with a headset. You could do this at home with a tablet, with a computer, with no limits. It's really about exploiting the power of that technology to excel in how we teach, in how we learn. We use digital atlases that were big books, written books with excellent illustrations or then pictures, to digital atlas, to now extended reality platforms that allow us to perfect how one or many people learn at the same time. We are adding the power of haptics, the power of kinesthetic haptics, the power of touch, adding one more sense, not just visual or audition, but also adding the touch. And we can have many platforms out there, different types of gloves that allow us to palpate what we could not touch before, to feel the virtual reality world in a way, to be able to hold that drill with a pair of gloves, but digitally. And we're able to feel the different textures. We're able to feel the different densities of tissue as we go through the knee in this particular case. Again, imagine the potential in the operating room of do preoperative planning, preoperative learning and saying and experimenting in a way until you get it perfect before you touch the patient, before you touch your mother or your father or your grandfather or someone's grandfather or grandmother. The potential is unlimited, only limited by how creative we are, only limited by our imagination, by the smart use of the technology available today. This is a rendering of the VR glove, which is kinesthetic haptic gloves being used to learn basic trauma resuscitation and examination skills. For example, you can feel that patient when you turn that patient. You can actually, in a way, feel that extended reality. And we have now many technologies that allow us to almost live that reality by the way of suits. That's an old video, but nowadays you have gloves and you have jerseys and you have pants and vests that allow you to feel everything. This is the Haptex glove. I had the blessing of trying this at AWE conference recently in Santa Clara, where I presented the new generation of the Haptex glove. Allows you to feel a feather in virtual reality, to grab a stylus and basically write your name in virtual reality as if you were in real life, as if you were in a real reality. So the potential is really, again, only limited by our creativity. The technologies are getting better and better, and all these headsets can now measure where you look and how long you look and how you hesitate, and they can measure sometimes your blood pressure or your temperature or your heart rate or your electrical brain activity, giving you a measure of how well you are achieving that top performance. Even microscopic surgeries, in this case ophthalmology, we can operate on an eye in a simulated digital fashion in virtual reality. If we can bring that eye texture, the density, imagine how millimetric that is, how fine the touch, the feeling. You can do that with this platform. You can immerse yourself in that reality of the OR, in the microscope, and then grab the tools and start cutting the cornea and placing a lens. It is unbelievable, and we are barely touching the surface. If you add artificial intelligence, the possibilities of having platforms that incorporate artificial intelligent algorithms to learn and then to guide us and to prevent errors and to maximize outcomes is incredible. You have technologies like digital surgery here from Touch Surgery, a UK company, and this is an old video, but you can record a surgery and you have an algorithm learn of how you do a surgery and try to help you improve on how you perform and then prevent you from committing errors. And have that all in there like a black box in surgery, teaching you and helping you basically maximize your learning, maximize the teaching by the way of technology. It is phenomenal. It is the future of surgery, driven by artificial intelligence and visualization. If you think of how we look at images in the past and how we do it in 2D screens, now you can immerse yourself in the real anatomy of a patient, in this case an MRA, a magnetic resonance angiogram, and you can plan the surgery in virtual reality, and you can bring the patient into the experience and have the patient exactly understand where are you cutting, what are you targeting. It is incredible. Medivis is a company from the US created by neurosurgeons. You can bring that extended reality into the operating room. You can mix the unreal or virtual world, the digital world, to the real world. and mix the two, and then improve your visualization at the time of performing surgery. We are getting there. The matching of the digital and the real is becoming possible, and we're actually having this technology allowing us to perform better and more precise surgery to a sub-millimetric precision, increasing the benefits for the patient, improving the outcome for the patient. So I think that we are barely touching the surface, and these technologies are going to revolutionize how we plan and how we do surgery, integrating all of that into the OR. And Medivus is one of many companies. You have Apoclar, and they have been doing this for more than a couple of years, and the pandemic has accelerated all of this. Apoclar does a similar ecosystem where they basically bring that images from a 2D screen, even if it's a 3D image in a 2D screen, they bring that image to the spatial computing world. You're not limited by a screen. The space is your computer, is your desktop in a way. And you have a HoloLens 2 here by my friend Atul Gupta, and HoloLens and Philips project, basically ergonomically and taking human factors and ergonomy into consideration when you look at images when you're performing an invasive cardiac procedure in the cath lab. The possibilities of improving the outcomes because you're improving the human factor system and the human factor thinking is really unbelievable. You have companies like Brain Lab, which is bringing all mixed reality by the way of the mixed reality viewer and the Magic Leap device. You're bringing that into the operating room. You can have computerized surgical navigation systems into mixed reality, and you can have basically a headset that tells you where to go. And you're not limited, like in a computerized tomography, by the axial plane or the coronal plane or the axial plane. You have an infinite number of planes that you can play with by the angle of attack of that image in three-dimensional real-time rendering. So it is a way that we have never been able to experience before. You're creating a new generation of surgeons that are utilizing these tools with the help of the industry to improve patients' outcomes. This surgeon in Japan is using a mixed reality headset, the HoloLens 2 as well, during live surgery, combining the image that the endoscope or the laparoscope gives him of the inside of the patient's abdomen, in this case a gallbladder operation. He's mixing that with mixed reality, with a rendering on mixed reality, and he's combining the two, going from the real world in the screen of the endoscope to the actual mixed reality viewing. And you can improve the detail, improve your navigation of that very difficult anatomy sometimes by the smart use of technology. This is one example of what is possible when we, in a smart fashion, combine that technology in order to help us do better medicine, do better care. We've all heard of robotic surgery, and there are many systems out there, from the old intuitive Da Vinci's to the CMR Versus robot and many others. If you incorporate these technologies to this type of devices, from the training on these devices to the actual performing of an operation using an AI algorithm and XR in order to help us navigate that geography of the patient using robotic assisted surgery, I think the future is going to be really exciting, especially now that the robotic assisted surgery is exploding in a way. We don't have one or two devices, we're going to have many devices. We're democratizing access to these devices in a way that we've never seen before, because they're becoming modular, they're becoming less expensive, they're becoming more accessible in a way. This is the SP, the single port device that has been out for about a year now from Intuitive. This is really technology to its maximum. Through a 3-centimeter incision, you bring this port with now 4 channels, a camera and 3 instruments. Almost looks like an alien picture of sorts. You can really transform radically how you do surgery by the use of this technology. So we have to use our imagination. We have to think beyond. This is a company called Neurable from Michigan, the University of Michigan. They are using electrical activity from the brain, so basically mind power, to navigate, to use a robot. So think about that. You could be, with your mind, driving tools and driving a mouse, a pointer, or even an instrument, like in this case, in virtual reality, at a distance, not wired, not connected by wires. You are managing and driving a robot. So imagine the possibility of this, okay? You are doing this and you are basically doing surgery in VR remotely. So now this is still a real possibility, it's just a dream. But imagine the possibility of that dream. Imagine the way you can transform how we connect and communicate. It is really exciting. And from going from big computers to laptop to tablets to headsets, now we're going beyond that. We have companies like Mojo or InWith Corp that are putting circuits in lenses. And you are able to navigate that extended reality or the augmented reality, the digital world, through a device that goes in front of your eye, that becomes part of you. So this is becoming real. Within a few years, 3 to 5 years, we're gonna have this instead of headsets. And we're gonna be able to navigate the digital world, that metaverse that we all talk about, or the Mediverse, or attend the Meta University or Metaversity that people talk about, especially Dr. Ahmed. We are going to be able to go there without even having to put a headset on, but just by using a contact lens, like in science fiction movies. We've all seen Star Trek and how we could teleport ourselves, the ultimate connectivity. Well, that is already possible in a way, in the way of virtual reality. You have companies like Beam from Aetho, which is the name of the company, and Beam is the platform where you can beam anyone from anywhere in the world into your space, and then all meet in a digital area that is common to all, and you can manipulate a common digital object. Imagine you're discussing a case intraoperatively and you are bringing up the image of the liver and how to operate on the liver. You can have experts from all over the world connect with you virtual reality. This is a company called Ventana, and that company basically proved that that's possible a few years ago. Now you have a company called Proto that has popularized beaming yourself up as a hologram anywhere in the world, and they are having tremendous success. I had the chance to try this at Santa Clara at an AWE conference, and it's phenomenal. Imagine the potential for educating patients or for giving an opinion in real life, in real time, the way of a hologram. I think that, you know, the future is really, really exciting, and we're barely touching the surface. We have to keep ourselves thinking outside of the box. In a way, we have to jump outside of the box in order to really make strides, to really reach the potential that technology, that the magic technology is giving us. And it's not the technology, it's the intelligent, the smart use of the technology in order to make us better, enhanced, more augmented surgeons and humans in a way. Because it is not about healthcare. It is about humane care. And paradoxically, these technologies can really improve how we connect in a more empathetic and compassionate way. So thank you very much. It's been a pleasure to be here with you.